Hello. You have been noticed that there is a significant increase worldwide in mental illnesses associated with aging, such as Alzheimer's and other memory disorders. According to the World Health Organization report, more than 55 million people are suffering from dementia at present. Therefore, in my opinion, knowing about this disease and understanding the necessary factors to prevent it is essential for everyone after 40 years of age. Hence, today we will discuss some commonly used medications that significantly raise the risk of these memory related diseases. We will talk about 7 types of medications that increase cognitive impairment and weaken memory. And we will also discuss what you can do to prevent this. And indeed, always remember to consult your doctor before changing or stopping any medications you are using. So let's find out all the details of these medications. Number 1. Anticholinergic drugs. At the top of our list are anticholinergic medications, which are used for various conditions in the body. Commonly used for allergies, some sleep aids, and some medications related to bladder issues. These medications can increase the risk of memory disorders. Common medications among them include diphenhydramine, oxybutynin, and amitriptyline. While they provide significant benefits for the conditions they address, excessive and unnecessary use, particularly in old age, heightens the risk of dementia. According to a 2015 study, older adults who use anticholinergic medications extensively and for prolonged periods increases their risk of memory disorders by 54% compared to those who do not use these drugs. The effect of these medications is dose dependent, meaning the greater the intake and extended duration of consumption, the greater the risk of memory disorders. These drugs affect a neurotransmitter called acetylcholine, which is crucial for brain functions like memory, learning, and comprehension. And blocking acetylcholine through these medications increases cognitive impairment. Number 2. Antidepressant. Second on the list are medication used for depression and anxiety, particularly tricyclic antidepressant, including amitriptyline, nortriptyline, and clomipramine. While their use reduces depression, but according to research, excessive and unnecessary consumption increases the risk of memory disorders and cognitive impairment. A study published in the Journal of Clinical Psychiatry in 2018 observed that individuals who use these medications for extended periods have a 30% higher risk of dementia compared to those who do not use them. The study found that due to the anticholinergic effect of tricyclic antidepressants, cognitive impairment increases, reducing memory and comprehension abilities. Additionally, these medications cause sedation, which can worsen brain functioning, and this risk increases with higher dose and longer use, particularly among older individuals who already have a higher risk of cognitive impairment. Number 3. Benzodiazepines. Benzodiazepines are medications commonly used for issues like insomnia, treating anxiety, or needing sedation for some medical conditions. These include diazepam and alprazolam. They can be beneficial when used for a short period as prescribed by a doctor. But unfortunately, people become dependent on them and believe they can't sleep without them, leading to prolonged usage. This increases the risk of memory disorder. In 2014, it was observed in older adults that those who used these drugs for more than 3 months had a 51% higher risk of developing dementia. This risk depends on the dosage amount, meaning the more and the longer one takes it, the higher the risk of dementia becomes. Research suggests that benzodiazepine can increase cognitive decline because these drugs suppress the central nervous system, resulting in decreased mental function and memory. Furthermore, these drugs can cause sedation, making one feel sluggish and sleepy. Number 4. Statins. Fourth on our list are statins that are commonly used to reduce cholesterol. Atorvastatin, simvastatin, and rosuvastatins are quite popular. They reduce cholesterol and lower the risk of heart diseases and stroke. But according to modern research, excessive use has a detrimental effect on our mental health. In 2020, research showed that people using fat-soluble statins have an increased risk of issues like dementia, since these statins can cross the blood-brain barrier and affect the brain. This research suggests that these drugs impact cholesterol metabolism in the brain, which is largely made up of cholesterol. However, it has been observed that statin that does not cross the blood-brain barriers does not increase the risk of dementia. It is important to note that using statins for heart diseases prevention is considered more crucial than the risk of developing dementia. Nonetheless, if anyone experiences significant issues, they should consult their doctor about it. Number 5. Opioids. On the 5th spot are opioids, which are commonly used for treating moderate to severe pain. These are often used to relieve severe pain after surgery or an injury, and are very effective. Typically, opioids include oxycodone, hydrocodone, and morphine. They significantly reduce pain, but their excessive use increases the risk of mental illness. This is why the risk of cognitive impairment increases. According to a 2021 study, those who use opioids for a longer period of time experience a significantly higher risk of cognitive impairment. Number 6. Proton pump inhibitors. Proton pump inhibitors are the medications that are used for various stomach-related issues. These drugs are prescribed for acidity, stomach ulcers, and heartburn. These include omeprazole, esomeprazole, and pantoprazole, among others. By reducing hydrochloric acid in the stomach, these medications improve numerous stomach-related symptoms. However, recent research suggests that they negatively impact our cognitive health. In 2016 study found that the long-term use of proton pump inhibitors increases the risk of cognitive impairment. According to the study, specifically older adults who use PPIs daily have a 44% increased risk of cognitive impairment compared to those who do not use them. Research indicates that multiple mechanisms might contribute to cognitive impairment. One theory suggests that proton pump inhibitors affect beta amyloid and tau protein in the brain, which raises the risk of Alzheimer's disease. Furthermore, PPIs decreases the absorption of essential nutrients such as vitamin B12 and magnesium in the body, leading to deficiencies in these nutrients, which subsequently increases cognitive impairment. Number 7. Antipsychotics. At the end of our list are the antipsychotic medications that increases the risk of dementia. These drugs are used in treating severe mental illnesses such as schizophrenia, bipolar disorders, and major depression. Common antipsychotics include risperidone, olanzapine, and quetiapine. These medications can be life-changing for those who need them, but according to recent research, they particularly adversely affect mental health in older age. A 2019 study demonstrated that older individuals who use antipsychotics have a significantly higher risk of developing dementia, especially when these medications are used for extended periods. These antipsychotics affect the neurotransmitter system in the brain, leading to increased cognitive impairment. Additionally, they cause sedation, which negatively impacts mental health. Therefore, if one is using antipsychotic medications and experiencing increased cognitive weakness and forgetfulness, it is essential to consult with a doctor. So here were 7 medications that increases the risk of dementia. If you are using them and experiencing memory problems, be sure to consult with your doctor and use them only as long and in the dosage recommended by your doctor. Thank you for watching the video this far. We hope you liked the video. If you enjoyed it, please like and share. And if you are visiting the channel for the first time, be sure to subscribe. We will see you in the next video. Allah Hafiz.